So you hear about people talking about the thyroid.
Thyroid
Doing
what
this, thyroid doing that. Girl, you know I can't go to the store because of my thyroid.
So what exactly is the thyroid? What does it do? Where is it? And what's its purpose? Let's take a look. Here are the facts. About 20 million Americans have some form of thyroid disease. And unfortunately, women are 8 times more likely to be affected. Did you know that 1 in 8 women will develop issues with her thyroid during her lifetime? These issues include, but are not limited to, low or excess thyroid hormone, inflammation, nodules, or cancer of the thyroid. Of these, low thyroid hormone production, also known as hypothyroidism, is the most common. Thyroid gland actually sits right here on your neck. It sits between your voice box and your collarbone. It actually wraps all the way around and has 2 separate sides. And in some instances, the thyroid can actually get enlarged, and when that happens, it forms a goiter, where you get swelling of the gland actually in your neck, and you can see it protrude out. In terms of what it actually does, the thyroid releases thyroid hormone. And what does this hormone do? It's actually responsible for every single aspect of our development, from our day-to-day functioning and overall well-being. So it's actually very powerful, and it does a lot in your body.
So what are the symptoms of having a low thyroid? Well, actually, the symptoms can be quite subtle, and most people don't even realize they have low thyroid until things have gone too far. I like to think of the thyroid as kind of your get up and go hormone. It's responsible for pretty much every aspect of your body and getting everything revved up to go. So when it's low, you have symptoms such as brittle hair, brittle nails, dry skin, puffy eyes, puffy face. It can even bother your concentration, feel a little dizzy as well, low blood pressure, low pulse. Even your temperature sensation, you'll feel really cold all the time. It also causes constipation, slows down your entire metabolism. So even though you're exercising, trying to eat right and lose weight, you're gaining weight like crazy. You're wondering, why is it happening? Muscle aches and pains or your period can really get out of whack because of your thyroid. It also can affect your cholesterol as well, making those levels really, really high. It can also influence your sex drive, where you're not in the mood for it, don't want it, and even your overall mood, you can get very depressed just from having a low thyroid.
So are you that 1 in 8? What are your risk factors for actually having low thyroid? Well, one of them is autoimmune diseases. Autoimmune means that your body's immune system actually attacks yourself. You can actually have an autoimmune disease that directly affects the thyroid, or it could be a consequence of other autoimmune disorders like lupus. Medications can also put you at an increased risk for getting low thyroid. One of the more popular ones is lithium. That's actually a mood stabilizer that people who have bipolar disease take. Also, certain antibiotics and medications that help to prevent seizures and treat seizures can also lead to low thyroid. But the list is so long, so make sure that any new medication you're on, just talk to your doctor about it and be well aware of the benefits and the risks. Another risk factor for getting low thyroid is actually having an iodine deficiency. So remember we talked about goiter in the beginning of the episode? Well, back in the day, goiter was really prevalent because there was actually a lot of hypothyroidism going around because people had an iodine deficiency. Iodine helps your thyroid function properly. So when it's low, you end up getting this goiter, which is a sign or symptom of hypothyroidism. The federal government actually mandated that iodine be put in salt in an attempt to reduce the prevalence of low thyroid. But now the problem is that there's a lot of bad diets around, right? People want a low salt diet. People are doing Himalayan salt and gluten-free. All of these things can actually cause you to have a low iodine level and therefore result in goiter and hypothyroidism.
So ladies, I just want to shed light on one other aspect that thyroid plays a very important function, and that's pregnancy. One of which having low, healthy red blood cells. You can have spontaneous miscarriages. Even within your delivery, you can have something called preeclampsia, which is you have really high blood pressure. You can spill protein in your urine.
It can affect your liver. It can even cause you to have the baby early.
Have the baby early. even seizures, and sometimes even deaths. After you have the baby, you can have lots and lots of bleeding that's hard to stop. There can be complications in development.
So all of these like developmental delays,
low birth weight,
can all be a complication. But there is a newborn screening for all newborns in order to check for congenital hypothyroidism, or the kind of thyroid issues that are present when the child is born. So how do you get your thyroid function checked? Well, fortunately, it's pretty easy.
really easy.
Yeah, it's just a blood test, and your doctor will be able to see what your thyroid level is. And depending on the results, your doctor can ask you to get some further testing, like an ultrasound, which looks at the anatomy. And then depending on that, they could ask you to do some further testing, but it's a step-by-step process.
Absolutely. And even the treatment's very simple. It's very easy. You just take one pill once a day in the morning.
Done. Artificial thyroid.
Key thing just to know is just have a discussion with your doctor about dosing and the side effects of the medication, because too much thyroid can be an issue too. So develop that relationship with your doctor and work it out.
Oh, no. What's our name?
So what's our name?
Well, we hope we made hypothyroidism both educational and entertaining.
And definitely stay tuned for a future episode about hyperthyroidism. Okay, see you later.
Bye.